Hello, can you all hear me? Thank you so much for joining me today. I'm very excited to have so many of you join me in today's 2024 quarterly webinar series. If you can hear me in the chat, please give me a thumbs up so I know that my audio is working correctly. Great. Okay. So today's presentation, I'm going to continue in English. And as I said, this is the first edition of the 2024 quarterly webinar series. My name is Laura Johnson, and I'm very excited to have everyone here today. I'm the regional manager of Dan World in Latin America and the Caribbean. And as we get started, I would just like for everyone to remember the live chat box that we have in YouTube. And if you would just introduce yourself in the chat box, let us know who you are and where you're joining us from today. And also, if you have any questions during today's presentation about the introduction to women's health and diving, go ahead and add them into the chat box as well as we go through the presentation so that when we get to the end, we can answer some of your questions. Also, I would like to introduce some other people that are with us today. Our medical expert and medical support during this presentation is going to be Dr. Dario Gomez. He is connected in the chat, and I think you all will see him in the chat. He just said hello. So welcome, Dario, and thank you very much. I know that Dario is going to be answering questions that really need to be answered by someone who's more of a medical expert than I will. So he is available in our chat, and I will be liaison with it, connecting with him for any additional questions that are beyond my scope. So also remember that our webinar today is being recorded, and it's going to be available for the replay tomorrow. So that way you can share that replay link. It's the same link that you used to join today with all of your dive buddies if you found this information helpful. Don't forget also to subscribe to our channel, the Dan World YouTube channel, so that you won't miss any of the upcoming webinars and the rest of our 2024 series. I see a couple of you asking in the chat already if the presentation is going to be done in Spanish. Today's presentation will be in English as advertised, as promoted. We are going to do other seminars or webinars in the 2024 webinar series from Dan World that will be in Spanish as well. But the particular one today will be in English only. So with that, I'd like to go ahead and get started. All right. So for today's topic, again, we're talking about an introduction to women's health and diving. And as you can see, we've got quite a few topics that are included in the presentation that are interesting for women's health. We know that there are a lot of different issues that are interesting to women divers. And this presentation is designed to be information that anyone can use, even dive professionals who are not women, who would like to know more about their women dive buddies, their fellow divers, their customers who may be women, in case they have an additional questions they ask as they go through dive training. So today we're going to talk about issues such as thermal protection, pregnancy, postpartum, and lactation, menstruation and PMS, oral contraceptives, cancers, and implants. Today's topic is also one that I chose to share with you today because I found that as I went through my initial dive training, and my open water instructor happened to be a man instead of a woman, and he didn't really bring up any of these interesting topics about women and diving, and I didn't really feel comfortable asking him. So I wanted to provide this talk as a resource today for all the women divers out there that maybe wanted to ask but never have. So with that, I will go ahead and move forward with the first topic. We know that when we look at divers worldwide, approximately 60% of certified women divers are between the ages of 20 and 39 years old. And this information comes from actually reported by Patty in 2021. So we know that the age range that seems to be affected by a lot of the different types of conditions and things that can happen to women divers commonly happen between this age as well as others. But we know that 60% of women divers are between that age range. We also know that there's physiological differences in women that can affect their diving experience. So that's what we're going to talk about more today. Some of these different types of situations and conditions, like everything from cancer to breastfeeding, that can have an impact on diving. So again, thermal protection is our first topic today. And this is one that affects me personally. We know that women are more susceptible to cold. Some of the contributing factors of this include body composition, specifically body fat content, muscle mass, and body size. And then some of these differences are hormonal and some of them are anthropometric. So how many of you women divers have ever experienced that you're with a dive group and everybody seems to be having a perfectly good time on your dive, and you're constantly giving the I'm shivering, the I'm cold sign to your buddies? That happens to me all the time, especially if I'm doing deeper dives. And so I learned very quickly that I tended to get colder compared to a lot of my male dive buddies. So what are some of the things that we might want to be able to consider to help us with that situation? One is a proper fitting wetsuit. So with a proper fitting wetsuit, the correct size and the correct conditions according to the water, like how many millimeters wetsuit, if it's a shorty or if it's a complete long wetsuit. Those kinds of things are definitely something we should consider to keep us warm while we're diving. I personally have found that when I added a hood, even if it was a lightweight tropical style hood, to my dive gear, that it made a tremendous difference in how comfortable I was during my dives. Other types of accessories that might be helpful, if they're permitted, include gloves to keep you from help keep you from getting so cold. And of course, if the conditions merit it, it would be worthwhile to learn how to use a dry suit. I definitely have been in situations. I know approximately 2 years ago, I found myself diving in the Red Sea in March, and it was quite windy, and the water temperature was below 70 degrees Fahrenheit. And so when I realized that my dive guide was wearing a dry suit and then I was in a wetsuit, I knew that it was going to be a very difficult dive for me. Thermal protection is something important to consider, because if we're very uncomfortable and constantly thinking about how cold we are during the dive, it can be distracting, and we may not be able to pay attention to other things going on in the dive or take care of emergency situations. So that's one of the first topics that I wanted to bring up around women in diving. The next topic I wanted to mention is pregnancy. And this is a topic or a question that sometimes during our initial dive training, we don't learn that much about. We've just heard that it's not good to dive while we're pregnant. Well, I wanted to share a little bit more information. So first of all, you should understand that there's very little scientific evidence on the effects of diving, diving during pregnancy and its impact on the fetus. The information is not there. And part of this is just because it wouldn't be ethical to do studies on pregnant women and diving and take the risk of the fetus. So the most of the evidence that we have is just totally theoretical. It's not actual evidence. Some of the things that we should consider about diving when pregnant is that there's a redistribution of fluids in the body. There's also fluid retention and morning sickness. Now, why might these complications be important things to consider when you're diving? Let's go ahead and go with the most obvious one, morning sickness. If you have morning sickness and you're on a dive boat and the seas happen to be sort of rough, it's just going to make your morning sickness even worse. So sometimes dive conditions can interfere with or can complicate the morning sickness process already. And it's not a good idea to be in an even more uncomfortable situation when we're diving like that. The redistribution of body fluid is an interesting complication. Why might that be something we should consider as divers if we're pregnant? And it's because it decreases the exchange of dissolved gas in central circulation. So theoretically, this fluid can be a site for nitrogen retention. We can't really do, again, as I said, test on pregnant divers to see how correct this is. This is all theoretical evidence, and it's one of the reasons why diving while pregnant is not recommended. Fluid retention is another complication, and why might that one be interesting for women divers? Because fluid retention during pregnancy may also cause some types of nasopharyngeal swelling. In other words, swelling here in the sinuses and nasal passages. This could lead to congestion in the nose and the ears, which of course could affect the way we equalize. It may lead to complications with things like ear barotrauma. So, considering these complications, what some of the things that could happen to a pregnant diver, of course, include decompression sickness, middle ear barotrauma, as I mentioned, increased motion sickness when it comes to morning sickness and possibly being on a dive boat. And just the effects of recompression treatment on the fetus is something to consider because, again, studies would not be ethical to try to find scientific evidence of this. So it's information that we don't really know. Because of all this, the conclusion is indeed pregnant women and women who are actually seeking to get pregnant should not dive. So why would I say that women seeking pregnancy should not dive? And it's because most women who are seeking pregnancy don't necessarily take a pregnancy test before every dive they do. Some of them might, but some of them who've been seeking pregnancy for a while may not do that test before they dive and may not know if they're pregnant. So that's one factor to consider. So now let's move on to our next topic, which is returning diving after giving birth. Here, how they always, women who have given birth always ask, how long do I need to wait before start diving again after having my child? And the answer is it's really going to depend on what type of delivery was the one that you chose or the one that actually happened. So there's different types of deliveries to consider. The one of the common types of delivery is just regular vaginal delivery, and that means there was no C-section or cesarean involved. So a regular vaginal delivery with no complications. A woman, it's advised that she avoid diving for at least 3 to 4 weeks, which is approximately a 21-day minimum. If the birth was a cesarean or C-section delivery, it's recommended to wait at least 8 weeks. And that is if there are no complications from the C-section. It does take longer for the body to heal after a C-section, and other types of complications can occur. So if there are no complications from the C-section, then most women would wait at least 8 weeks before returning to diving. Then there are also some other types of birth that definitely deserve mentioning. And that is if a woman has twins, if she has preterm labor or has early labor, or other complications. In this case, definitely a medical screening and clearance are advisable before returning to diving. And that's because it's not possible to say without this medical clearance how long she should wait before going back to diving. Um, Giving a little more detail when it comes to vaginal delivery, the particular 21 days minimum is a period of time that's recommended because it allows the cervix to close and limits the risk of infection in the genital tract. So that's what that evidence is based on. When it comes to the C-section, the general at least 8 weeks recommendation is there to ensure wound healing and to give the body enough time to be able to regain resistance. Regaining resistance is something that a lot of divers might not think about that would be affected after a C-section. But if you've had one, you probably realize that you may not be able to do right away the same type of activities that you did before. So then the next part of returning to diving after giving birth is also to consider that many women during that period are breastfeeding as well. So, diving is definitely an activity that is safe and a safe activity for mothers who are breastfeeding. But there is the question, what about certain risk? Would the infant be at risk of accumulating nitrogen from the breast milk? And the good news there is that although nitrogen accumulation does happen in the mother's tissues during the dive, there's no risk of the baby accumulating this nitrogen through the breast milk. An important factor to remember too, if you're breastfeeding during the same period that you're going to dive, is to stay well hydrated. Um, Hydration is a key factor in many other risk of diving accidents. So, in order to avoid that, and in order to consider that the women need to stay well hydrated during breastfeeding time, that's a good advice. And also remember to avoid diving if the breasts are inflamed or infected, which sometimes happen during the period that the woman is breastfeeding. So now let's go on to our next topic here, which is going to be premenstrual syndrome or PMS. And most women may know this, is that during PMS or premenstrual syndrome, accidents in general are more common. More dive accidents, but just accidents in general. So one recommendation that we can definitely put out there is to just dive more conservatively during this time. If a woman has premenstrual syndrome or PMS, diving more conservatively can help her stay a little bit further away from her limits in diving. That may be one way of diving more conservatively, or also maybe limiting a little bit more the bottom time during this time. So when we look at women and PMS and the relation to decompression illness or DCI, we see that there's no scientific evidence that women with PMS are more susceptible to those conditions or to dive accidents. So again, that's scientific evidence. The studies that have been done show that women with PMS are not more susceptible to decompression illness. However, when it comes to menstruation, there are several other factors that we might also ask about. Theoretically, menstruating women may be at a higher rate of DCI, but also this is not proven. There's no scientific evidence of that either. While diving while menstruating does not seem to be a problem, as long as the woman can carry out normal vigorous exercise if she has any menstrual symptoms. So if menstruation for a particular woman seems to be so complicated that she's not able to do vigorous exercise because she has less resistance, less energy, then it may not be recommended to dive during this time. However, as long as the normal vigorous exercises are not a problem for her, there's no reason why she should not dive while menstruating. Let's look again about maybe theoretically why menstruating women may be at a higher risk. Again, it's not proven, but why might that be? Theoretically, it's possible to do it to fluid retention and tissue inflammation that women are less able to get rid of dissolved nitrogen. Again, that's all theory and it hasn't been proven, but it's one of those factors that's just interesting when it comes to women and menstruation and diving. The last point that I wanted to bring up here about menstruation is a lot of women have actually asked me, how about diving with the menstrual cup? Is that safe? And what about the air spaces? So this is definitely something that my dive instructor never mentioned to me. And I did want to put it out there. Many women today do dive with menstrual cups. And it's interesting that any air that's trapped in a menstrual cup will be compressed as you descend, and then it will expand again to its original size upon ascent. So it shouldn't cause any problems while you're diving. Many women, of course, prefer to dive with the menstrual cup because it doesn't involve complications with tampons, where, for example, complications with tampons while diving might be that you're on a very small boat with a bathroom and you can't change it. So usually a menstrual cup allows us not to have to worry about changing so often. And this is very convenient for diving. So that's why a lot of my dive friends like to use menstrual cups while diving. Let's go on now to our next topic here. And that's going to be oral contraceptives. This is interesting. Of course, not all women decide to take oral contraceptives, but the ones that do, there's the question on whether or not this affects their diving. So unless oral contraceptives pose a clinical problem for women, there's actually no scientific data to show that their use during recreational scuba diving is a contraindication. There's no scientific data. Any information out there, again, is all theoretical, but the information does not show that it should be a problem. The data analysis suggests that women taking oral contraceptives have an increased risk of DCS during menstruation, but again, it's not proven. And what might be some of the factors that make this theoretical? So it's been suggested that oral contraceptives may increase a diver's susceptibility to DCI because of hormonal changes, which may actually reduce the venous tone or the increased water retention in the woman's body. And this could affect circulation and theoretically cause the blood to have an effect sort of like sludging, which may interfere with the elimination of nitrogen. But however, to date, although this is theoretical, there's no research that shows any evidence to support this belief. So what's suggested for menstruating women if they're going to be diving? It's suggested that maybe they dive more conservatively, especially if they're taking oral contraceptives. That might, as I said before, I mentioned it might look like making fewer dives during their planned dive trip, make shorter or shallow dives, and maybe even just adding in longer safety stops might be some recommendations here. So now let's go on to the next topic about ovarian and breast cancers. I know that I have a lot of friends who have told me that they were very active in diving, and it was very difficult for them not to dive during their cancer treatment, and they went back to diving as soon as they were able to. And those kinds of stories make us all happy to hear. But let's learn a little bit more about some of the factors involved. So when a woman is going through chemotherapy or radiation treatment for either ovarian or breast cancer, diving is not recommended. And the reason why this is that radiation and some other chemotherapeutic drugs can cause pulmonary toxicity. The health of our lungs is something very important to consider when we look at anyone's fitness to dive. So, what about returning to diving after the chemotherapy or radiation for ovarian or breast cancers? So, before returning to diving, it's recommended to have a lung test to be able to rule out the presence of damage that might increase the risk of pulmonary bear trauma while diving. Sometimes women may need surgery after breast or ovarian cancer, and after surgery, the patient definitely should have completely healed and regained her strength and well being. So, when it comes to looking at what type of evaluation might establish the safety of returning to dive, it's going to be a lung assessment that would check to see if the diver is predisposed to pulmonary bear trauma. Pulmonary bear trauma includes things like AGE or arterial gas embolism, pneumothorax, or other lung conditions. So the doctor would be looking to see if there's any damage that might predispose her to those types of injuries while diving. Okay, the next topic is about breast implants. Are women with breast implants advised to dive? I get this question a lot, and it's also a very interesting question. Some women may ask if about bubbles in their implants when they dive. So let's look a little bit more depth in this. During diving, bubbles in the implants usually do not cause problems. We know that there are different types of implants. Some women have implants that may not be the most modern type out there, and others might have brand new modern implants. And all of these implants may be slightly different when it comes to bubbles. So when we look at the bubbles and the different types of implants that most women have today, the bubbles in those implants don't cause a problem during diving. A woman who has her implant surgery needs to remember that after surgery, when she's resumed normal activities and she meets General Fitness to Dive guidelines, and there's no risk or danger of infection, that she can return to diving. And generally, after surgery, the risk that the body has healed so that there's no danger of infection is a good thing to keep in mind, that she's going to want to have healed to be able to avoid infection. If she's able to resume normal activities, like being able to lift her dive gear and those kinds of things, would be important, and general fitness to dive as well. Dan has lots of information about general fitness to dive guidelines on our website, and you're welcome to check those out. So the general recommendation is that breast implants do not prevent or hinder diving at all. There is one type of implant that sometimes can affect buoyancy slightly, and that's silicone implants. But this is easily resolved, especially if the implants are large. Silicone implants might affect the buoyancy. But when proper training and proper weighting is considered, then it usually is not an issue. So doing a weight test after getting back in the water and testing out if your weight needs to be adjusted is something that can be important. And also, you might think about adjusting your gear just slightly, like maybe the straps that go across the top of the chest. When it comes to your BD, they shouldn't be too constrictive. They should be properly fitting, but just not to put any undue pressure on the women's chest or on the implants to avoid risk of rupture. But it would have to be very tight and not fitting properly in order to cause a problem. So with properly fitting gear, maybe make some adjustments on the straps, and adjustments on weight might be an easy way to resolve some of those issues. And then that brings us to the end of the main topics that I want to ask today. I want you to know that there are lots of resources out there on women and diving on our website. So the Dan World website is world.dan.org. We do have a list of health topics for women divers, the section or the tab that's called Health Resources. And you are more than welcome to check out that page. We do have that section available in several languages. Also, if you have a very particular question about your condition or your situation relating to women in diving, you're always welcome to go to the Ask a Medic form on our website. You can see that form at the address on the screen there, dan.org/ask-a-medic. And you can also call the Dan Medical Information Line. This is a non-emergency line that's available during normal business hours, Monday through Friday. And the number there is on the screen. It's a number that you do have to dial the US. It's an international number. The area code's 919-684-2948. Follow the prompts to get to the Dan Medical Information Line. So I want to thank everybody for your patience while I went through the main topics today. And then what I'd like to do now is also to check in with you here in the chat and see if there are any questions that I can answer for you. So you still got time to put your question in the chat. If you haven't already, please go ahead and do that, and we'll go through those. And again, it's a question that's beyond me. We do have Dr. Gomez on the line who will help us out. So I see lots of hellos. I see hellos from Venezuela. Thanks for joining us, Freddie. Let's see, Deborah from St. Croix, U.S. Virgin Islands. Glad you're here listening and joining in with us today. I see questions asking whether this information will be available in Spanish or not. I actually do have a copy of this presentation in Spanish because I've done it before in Spanish. And if you'd like to write to me individually, I can send you that. So my email, if you'd like to contact me directly for more information or to get a copy of today's presentation in Spanish, my email is ljohnson@dan.org, and I'll be happy if you'll write to me directly. I can send you that. Renata joining from Utila. Hi, Renata. Thanks for being with us. Diana, thanks for being here, Diana. Karina from Germany, thanks for joining us. Tamara from Puerto Rico. Hi, Tamara. Joe from the GoPro family. Joe, thanks for joining us in. Hope this information was interesting to you. Dr. Gomez is still in line with us. Hi, Dario. Kayla from St. Thomas, U.S. Virgin Islands. Okay, here's a question. And this question is from Deborah. She asked, how long do I have to wait to dive after having gallbladder removal? Okay, so this is definitely a question that would affect more than just women divers, because it could happen definitely to male divers too. So Dr. Gomez, if you are online with us, if you want to put the answer to Deborah's question here in the chat, I'll read that out for her. Let's see. Amanda from the U.S. Virgin Islands, thanks for joining. Judith from Cozumel, thanks for being here. Let's see. Who else have we got here? I see a question from Renata that says, are there enough studies about women menstruating and DCI? Again, Renata, a lot of the information when it comes to menstruation and DCI are just theoretical. There's actually not a lot of data out there. So there have been some studies done, but they did not come up necessarily with the conclusion that menstruating while diving was necessarily was something that is contraindicated. So there still needs to be more studies done because there's not been enough. The study sizes of the studies that were done were not enough to give strong scientific evidence to. So definitely more studies are needed. I see a question from Project Scuba. And Project Scuba asks, how about diving with chemo ports? So this is a question I'll also leave to Dr. Gomez if he could add that into the chat. I think that comes into, that question comes up from our diving with breast and ovarian cancers. So chemo ports are something that are a concern for some patients. And we'll wait and let Dr. Gomez answer that. I also see Anja joining us from Veracruz. Thanks, Anja. Okay, and here's the answer from Dr. Gomez. He says, yes, you can dive with chemoports if healed and freed from complications. Okay, and that's the key there. If healed and free from complications is something you want to make sure is happening before you want to dive with chemoports. But yes. Okay, Claudia, thank you for being here. All right, here's another question from Claudia. She says, what about diving for women with controlled diabetes? This is a very interesting question, and Dan has actually done a lot of studies about diving and diabetes. And you can find it on our website. We have this wonderful infographic on diving and diabetes that you can share with all of your dive buddies, or if you're a dive professional, you can share it with your students. I highly recommend printing out the infographic. You can find it on our website as well. And our website is still up there on the screen, world.dan.org. And you'll go to the health resources section and you'll find the infographics. There's a very interesting with infographic. I always used to think diabetes and diving was a very complicated topic until I read the infographic, and it's explained so well that it was very helpful. So highly recommend checking that out. Okay, we have a question from Nordsikan, and this question is, does DCI with women have different kinds of symptoms than with men? Are there studies that we know what we should be looking out for in addition to the normal symptoms? So I'll let Dr. Gomez chime in there if he has any other information. Also, I see a question from Anja, and she says, do you have any information about osteoporosis and diving? Fitness to dive is one of the top. General fitness to dive is one of the topics that Dan covers a lot, again, on our website. And there's also some more information about specifically about osteoporosis, I believe, in Alert Diver magazine articles. Alert Diver is the official Dan magazine. It is a digital magazine as well. Depending on where you live, you may not get a mail copy of it. But you can definitely read it digitally. And if you write to me separately, I will be happy to send you some links on that. It's a little bit of a complicated subject, so there's a lot of factors we probably don't have time to consider today when it comes to osteoporosis and diving, but I do have additional information I'll be happy to email to you. Okay, another question from Hans says, can we expect an increase in studies done specifically on and for women? Most topics don't seem to have specific answers. I believe that there are actually more studies done on conditions that probably affect both men and women divers. Like, for example, general studies on decompression illness, general studies on middle ear barrier trauma. So I'd agree, we definitely do need more studies. It's just a matter of being able to carry them out and being able to fund them, and the different organizations that can manage the studies. So I do hope that there are going to be more studies on women in diving. Dr. Gomez answered the question about gallbladder surgery. He says, in general, 6 to 8 weeks. And then Cecilia, she says, hi, Laura. Thanks for this webinar. Cecilia from Cozumel. Thanks for joining us, Cecilia. How about UTIs? Is that a common thing amongst female divers, specifically professional divers? Any suggestions on how to prevent those? Prevention of UTIs is very general, and it doesn't seem to be different from women who are divers rather than women who are not divers when it comes to prevention of UTIs. I'll let Dr. Dario comment on there if he has anything he wants to add for that as well. And then I see a question from Joe that says, would love to know more about how menopause can affect diving and free-diving, maybe another webinar. Thanks for that suggestion, Joe. We do have, again, general fitness to dive guidelines. And as divers are aging, which happens, menopause happens as women age, there are definite studies and medical examinations that are recommended as our health change. So following the general fitness to dive guidelines is very important. The evaluation for fitness to dive guidelines are on Dan's website in several different languages, so be sure to check those out as well. Dan says, is there any specific waiting time for diving after an abortion, and does it vary also according to the procedure? So that's a question that I was not able to get to today under the different topics, and I'll let Dr. Gomez add anything there that he would like to. Okay, I see a question from Mo, and it says, why aren't sharks attracted to period blood? Mo, from what I've heard, the answer to that is that really it's not enough. The quantity of blood that might be released from a diver who's menstruating and is not wearing a menstrual cup or not wearing tampon probably wouldn't be in the amount or quantity that would really attract a shark. Sometimes we see that in movies and things, but really there's no scientific evidence behind that. From what I've read, it has quite a large amount of blood compared to the amount of what's really menstruation. Amanda has a question. She says, is it safe to dive with yeast infections? Well, definitely it would be uncomfortable to dive during a yeast infection, but I will let Dr. Gomez answer that for us. It's also going to depend probably on what type of treatment you're using. There's different types of treatment, so I'll let him add in there. And then we have another question from Dan. It looks to be very similar to Amanda's question. Says also, candidiasis and professionals, is there a way to prevent them? I would believe that the prevention would be the same guidelines for women who are diving or non-divers. So again, if Dr. Gomez has anything to add in there, I'll leave that space open for him to answer. And let's see, any other questions before we wrap up today? Again, remember that tonight's webinar is the first in our series of 4 quarterly webinars that Dan World is going to offer this year. We are going to be offering the next seminar. It will be in Spanish in June. And we are lucky to have our Dan World Business Member Liaison, his name is Francisco Ramos, join us in June for a new topic he will be presenting in Spanish. So we will be sure to let everyone know. And again, if you subscribe to our YouTube channel, you'll hear about those upcoming webinars. Okay, so here's another answer from Dr. Gomez. Thanks so much, Dr. Dario, for being patient with us and answering so many questions today. He says, miscarriage and abortion, yes, you can die, but it does depend on the procedure. It's recommended a minimum of 6 weeks. So thank you for answering that question from one of our participants. So again, thanks everybody for joining us tonight. I appreciate everyone being here. If we did not answer your question and you want to write to me individually, I'll be happy to investigate and get more information to you. You can reach me again at ljohnson@dan.org. And I will be happy to reach out to you either with a copy of the presentation if you'd like to have that, or the presentation in Spanish if you'd like to share that. And remember, the replay of tonight's webinar will be available on YouTube within 24 hours. So you can share the very same link with your dive buddies and share this interesting information. So thanks again, everyone, for joining us. A big, huge shout out to Dr. Gomez for being with us today and providing that expert medical support. Thank all of our divers, especially the women divers, for your interest in this topic. And we look forward to seeing you again coming up with our second webinar next quarter. Everyone, have a great day or a great evening. Bye-bye.